Hello, everyone. My name is Jonathan Schmidt. I'm a freshman at the University of Connecticut studying nutritional sciences, and today I'll be presenting on malnutrition and dementia as part of this week's Malnutrition Awareness Fair. So, dementia is a neurocognitive disorder, and it's defined as a decrease from a prior cognitive level. Now, typically, when we think about dementia, it's a lot of times in terms of memory loss, whether it's short term memory loss, long term memory loss. Those are very, very common types of dementia. However, a decrease from prior cognitive level can be something like the inability to tie your shoes, um, a loss or lack of proper social functioning, or just the inability to carry out average daily tasks that we do every day. So it's very, very common um, among older adults in the United States. A third of older adults are dying with dementia. So it's not dying from dementia, it's dying with dementia. But it's very common that we're seeing lots and lots of types of dementia affecting a large variety of older adults. So not only are we seeing this um, loss of proper cognition, but we're also a large complication that can come with dementia is dysphagia, which is trouble swallowing. So a lot of these patients with dysphagia, um, they might be overwhelmed because of dementia. So they might be overwhelmed with the wide variety of food options on their plate. Might get easily distracted, and it can lead to a serious choking hazard. And they also, maybe in their old age, they might just have poor muscle ability, part of the digestive part as through the digestive system. So it might be difficult for the involuntary reaction of swallowing to just take place with the muscles in their digestive system. So a lot of these dementia patients have to rely on internal nutrition, which is feeding through tubes. As you can see right here, the one coming from the nose, this is a um, short-term option of internal nutrition, and it's typically only used in like hospitals, short-term stay, just for the immediate moment. But the one coming from the stomach, that is an example of a longer-term feeding tube, and those are typically looked after by at-home caregivers. Um, and so, uh, both of these types of internal nutrition require entirely liquid diets. Um, And a lot of these patients with these feeding tubes, because of the liquid diet, are malnourished. And malnourishment is defined as a 10% loss of body fat or body mass within a 6-month period. So a 200-pound adult losing 20 pounds, a 100-pound adult losing 10 pounds. Those both fall under the umbrella of malnutrition. So disease-associated malnutrition is so prevalent among dementia patients because, as I mentioned earlier, they cannot focus on the variety of foods, and they can't carry out activities of daily living. So they really all have to, many of them, I think a large percent of them have to rely on internal nutrition. So internal nutrition is very, very difficult, at least in the long term, to maintain. We're seeing a loss of balance, variety, and moderation in the diet. And those are all things necessary to uh, not only stay within the parameters of proper nutrition of uh, macronutrients, right? We want a large variety of carbohydrates, fats, and proteins in our diet. But we also want to see a lot of micronutrients intake, a wide variety of all our vitamins and minerals. Um, and so it's very difficult to have that when our diets are entirely liquid. And these long-term caregivers, they might not have the knowledge to provide a proper, diverse diet. And not only can these liquid nutrient formulas be expensive, but it's expensive to get a variety of them, right? You want various forms of nutrients being fed to your dementia patient every day, and it's very, very difficult financially to obtain this wide variety of liquid nutrients. So disease-associated malnutrition is so important because with malnutrition, we're seeing greater lengths of hospital stay. Right, these patients, they their malnutrition is impacting not only their just general functioning, but malnutrition can also has a strong link with cancer, cardiovascular disease, stroke, and obesity. Lots of other things can impact, or lots of other things can be impacted by malnutrition, which can lead to longer hospital stays, more expensive hospital stays, complication rates, all that are associated with malnutrition. And so, as you can imagine, with all of this extra hospital costs, we're seeing the United States government spending a lot of money, all to support these dementia patients who are suffering from malnutrition. And we could have avoided these extra complications and longer stays in the hospital in the first place if we just could find a way to provide proper nutrition to dementia patients. So not only, as you can imagine, is there a serious complication rate that is associated with malnutrition, but 21% of the population is projected to be above the age of 65 by 2050. So I believe earlier it was 1 in 9 Americans currently suffer from dementia. And now we're seeing 1 in 9 Americans is going to make up 21% of the population by 2050. So these expenditures are going to drastically increase, and we really need to take a serious look at how to address the issue of malnutrition among dementia patients. So some possible solutions are we really want to avoid endless nutrition for as long as we can. Less intervention is always better. We want to let the body do its thing to the best of its ability and ensure as long as it can function properly. So if these patients might be overwhelmed by the wide variety of nutrients and foods on their plate, one-on-one feedings are a great option, where you might have the caregiver sit down with the dementia patient and provide them one food at a time, foods that they like, and just watch them to make sure they're not choking, they're slowing down when they're eating, and really ensure that they can still utilize their mouth as part of their mechanical digestion and digestive system process, so we can avoid internal nutrition for as long as we can. And so when we need to use internal nutrition, oral supplements are a potential option to ensure that we're meeting our micronutrient needs. So a lot of times internal nutrition, it might have the caloric and some of the macronutrient intake needs, but we're really missing out on those vitamins and minerals. So oral nutrition supplements are a great way to supply dementia patients who might be lacking in some of those vitamin and mineral areas with the nutrients they need, just to help their brain function. You know, it might not be just malnutrition in terms of weight loss. That is malnutrition. Malnutrition is specifically in terms of weight loss. However, you know, just proper cognitive function can also be affected by different vitamins and minerals. So it's really important that these supplements can provide what the internal nutrition feedings cannot. We're also seeing in this is a very extreme case, but parenteral nutrition is feeding through the veins. So these now these liquid solutions aren't already entirely digested. We're not relying on the stomach or the small intestine. We're bypassing all of the digestion and absorption processes to go directly into the vein, where it will be immediately absorbed. So we know that all of the nutrients we give the patients will be directly absorbed into the bloodstream, and so we're not seeing the waste that we used to. There's a lot of loss of waste nutrients. So it's easier, however, we really ideally the goal is to let the body function on its own for as long as it can. So this is a potential way to ensure proper nutrition, but we're really not seeing this with at-home caretakers quite as much. This is once again more of a hospital scenario where it's easier. Malnutrition will be easier to avoid in the first place because it's more closely monitored. And we can also see malnutrition screening programs for individuals with these at-home caregivers. So through anthropometric measurements, these are measurements like weight, body mass, body fat, height, these kinds of things can all indicate if the patient is receiving the necessary nutrients in their diet or not. And so these screening programs can allow the like a doctor or somebody who's not the at-home caregiver to ensure that the dementia patient is receiving all the nutrients they need, and they can alert the caregiver if they need to be giving the dementia patient any additional nutrients, whether it be micronutrients or macronutrients, vitamins or minerals, or carbohydrates, or lipids or proteins, whatever it may be. These screening programs can really help alert healthcare professionals of potential malnutrition within a dementia patient. And it's also really important that we spread awareness among our medical and healthcare providers so they can really look for signs and symptoms of malnutrition. And we're really aware that this is a serious issue that exists among dementia patients right now. And so we can start to address it immediately, and we can start to save not only financially, but we can save quality life years for our patients and really make sure that they're living the best life for as long as they can. So, yeah, that's my presentation. It's really important that we spread awareness of malnutrition in all types, but specifically dementia, as it is a really big issue that currently affects the United States. And thank you for listening.